It was easy to learn, and in fact, it's easier to do than the old-fashioned paper way.
eTherapyDocs has helped us reduce errors overall. Less errors mean less insurance denials, and less insurance denials means increased revenue.
eTherapyDocs allows me to focus on what's really important, and that is the rehabilitation of these children. Big stretch. Here we go. Get it?
Hi, I'm Denise. I am the owner of Special Needs Pediatric Therapy Services. We have been practicing for 20 years. 20 years ago, we were writing our notes on paper, and as my practice started to grow and it got harder and harder to manage, I asked my husband Eric to write a program for me so that we could start to do things electronically. Pretty frustrated with the systems that were available because they were very limiting. And eTherapyDocs was written so that I could document the way I wanted to document for my patients.
eTherapyDocs is so much better than writing notes by hand because it allows you to expand on your note documentation. It allows you to do billing at the same time that you do your notes. It allows you to keep up with your quarterly reports. It allows you to communicate with other therapists through the login screen.
What I've found, kind of surprisingly, is that not only has it made things easier as far as our documentation, but it's increased the revenue in the practice. We are able to more efficiently bill our treatment sessions. In the past, treatment sessions were missed. My therapist would write their notes, but wouldn't include a treatment session in their billing log, and then the session wouldn't get billed. Now everything is incorporated into the program and we never miss a treatment session.
eTherapyDocs has become a huge time saver for me when it comes to applying for Medicaid authorizations. With this program, I can easily download and access notes and clinicals any time of the day that I want. eTherapyDocs has become one of those quality and productivity tools that I use every day in my job.
eTherapyDocs has decreased the cost, time, and frustrations associated with patient scheduling, documentation, and billing.
The therapists that work for me are independent contractors. They turn in their hour logs, and in the past, everything that was done on paper, I would have to hand tally in order to pay them. Now the system tallies out their hours for their treatment sessions and tells me exactly how much they are due in revenue at the end of each month so that I'm able to issue their paychecks very easily.
I've been doing this for about 6 years, and when I first started, everything was done by hand. The old-fashioned way with notes, it would take me up to a half a day a week to put in everyone's hours and their rates and calculate it by hand. Now it's just a few clicks of the mouse on the computer and I'm done. Probably 20 minutes for a week does all my payroll for me.
A new feature in eTherapyDocs is a therapist's ability to view their patient goals every time they log on to write a note. A pop-up box shows up in the note entry field, and we're able to reference the treatment goals, make comments about them in our notes, and that's been really helpful in getting insurers to recognize the medical necessity of each and every treatment session and how it's helping those children progress toward those goals. We use text reminders exclusively for our patients who have difficulty with their attendance. We've had patients who were at only a 50% attendance rate, and when we added text reminders, they're up to a 90 to a 95% attendance rate now.
I really appreciate the text reminders because it reminds the patient of their treatment time, and as a contractor, that's important to me because if they don't come, then I don't get paid, and it affects my revenue.
One of the biggest challenges of running a practice with multiple therapists is making sure that everybody has their paperwork done on time. We need to do updated plan of cares for patients every 6 months. And if we don't keep track of when those are expiring, then patients get treated without authorization and I lose money and my therapists lose money. Now I can send emails to my therapists in advance of their treatment week Not only do they get their schedule, but they get an update of all of the documents that are going to be expiring in the next 30 and 60 days. One of the things that's really helped me manage the practice well is that at the end of the week I can log on and I can easily identify if there have been any treatment sessions that haven't had notes associated with them for the week. This is important because my billing staff will bill first thing starting on Monday morning, and I need to make sure that all of those notes are in so that we don't miss treatment sessions.
I do what I do as a therapist because I love it, and I love working with the children. This program allows me not to have to worry so much about the paperwork and allows me to get reimbursed for the work that I love to do and not worry about all the details about the billing and the paperwork and documentation.